Hey guys, my name is Isabella and welcome to my ASMR channel. So before we get into today's video, I just want to remind everyone about a couple of different things that I offer in addition to my YouTube videos. I also have a Patreon, so if you want to support me, you can head over there where I post 4 additional videos each month for $3 a month. I also have an OnlyFans page where I post content 5 days a week. Lots of exclusive role plays and different things over there, so you can read more about that in my description box over on OnlyFans. Also, right now I am having a 25% off sale on OnlyFans. I also have a Vizio page for custom videos, so if you're looking for a custom video, right now is a great time to get one because Vizio is having a 15% off sale until the end of November. Lastly, if you want to follow me on Instagram, you can do so. My Instagram handle is linked down below. All of this stuff can be found in the description box down below. But now let's get into today's video. Hi there. Welcome. Take a seat, get comfortable. My name is Dr. Isabella, and I will be performing your cranial nerve exam today. Does that sound good? Okay. So, I was told that you were having some trouble with your vision. Your eye doctor couldn't really find any reason for it. Apparently everything looked okay. And even I was told that all the tests performed at the ophthalmologist's office, you passed and your results were normal. So, I'm going to be doing a cranial nerve exam because I just want to make sure that everything is okay, and we'll go from there, okay? So don't be nervous. Very quick and painless exam. Most people actually find it to be quite relaxing, so just relax, don't stress. We're gonna figure out what's going on, and to be honest, sometimes stress can affect our body in really weird ways. So before I kind of get into what I think it could be or could be causing it, if the cranial nerve exam doesn't really bring up any additional questions, so that's something we'll discuss, but I'm not going to get into that yet. Let's get started with the exam today, okay? So before we get started, I'm just going to ask you a few questions. Has anything significant happened past few months when these vision problems started? Did you have any trauma, injury, any reason why vision changes could be happening? Okay, so nothing really significant aside from starting a new job. Okay. Is this new job more demanding than your previous one? Okay. Well, that is good to know. But let's get into the actual exam now. And if you have any questions about anything I'm doing, feel free, do not hesitate to ask me. I always love to fully inform patients of what I'm doing. I think it's important that patients understand what is being done to them and why. So do not hesitate. If you have any questions, you want me to pause, explain something. But the first thing I'm going to do is I'm going to be looking at cranial nerve 1, which has to do with your sense of smell. So I'm going to have you close your eyes. I have a scent here that I'm going to be putting up close to your nose. You'll smell it and tell me what smell it is you believe. And if you're a little off, it's fine. I just want to make sure that if I give you the smell of cinnamon, you don't think it's paprika. And take your time. There's no rush. You can smell it. It does smell good. Okay. Okay, very good. Good. Yes. So, yes. So, this scent was sweet orange. Good. Yep. Orange does have a very specific smell to it. So, it's not it's not that difficult to identify. I'm not trying to trick you. I do like to pick something that I think you'll be able to identify. No, I don't think there are a lot of doctors out there that would do like an obscure smell that no one would be able to identify. So we're not we're not trying to fail you. So the next thing I'm going to do is look at Cranial Nerve 2. So for Cranial Nerve 2, I'm just going to have you cover one eye and then read from this snail in the eye chart. And you'll just read from this and just read from top to bottom, one eye covered. And take your time again, no need to rush. Good, very good. So now I just want you to cover the other eye, and now we will do the other eye. And again, take your time, but start from bottom to top, just because I want to make sure you didn't accidentally memorize anything. We want to make sure that this is as accurate as possible. Awesome, perfect, very good. Okay, so the next thing that I'm going to have you do, is a test that will actually be comparing your visual field with my own. So we're both going to cover the same eye, and then I am going to take my finger, and every time you see it wiggle, I want you to say yes, okay? Just so I know, and good. Good. Perfect. Awesome. And now I'm going to switch eyes, and I would like you to do the same. And good. Good. Awesome. Awesome. Good. Very good. So that was really great. So far, visually, I'm not seeing anything wrong. But let's continue on before we really start to try to diagnose you. Okay, so now we're going to move on to cranial nerves 3, 4, and 6, and those are kind of all tested in a similar way, so we're just going to do them all at the same time. Okay, so for this one, I just kind of want to look at the position of your eyes, the movement, range of motion of them. So can you start by just looking directly at me, please? And then I want you to look up. Look down, to the right, to the left. Good, very good. Okay, and the next thing I'm going to do is I want you to follow this pencil. Follow the pencil. And now follow it still. Follow, follow, good, good. And now I'm going to bring it real close to you, and I want you to keep following it. So kind of make your focus on the eraser point. So just keep looking, focus on the eraser, focus on the eraser. Good. And now I'm just going to do it one more time, okay? So I want you to focus on the eraser, focus on the eraser. Perfect, yeah. No, that was really good as well. Did you by any chance see double at any point? Okay. Okay. No, that's good to note. Okay, so for cranial nerve 5, I'm going to start by testing sensation on your face. So I'm going to use this eraser point again, but this time I'm going to be touching each side of your forehead, cheeks, chin, and I want to make sure that when I touch those areas, they feel the same on both sides. So focus on the sensation. You can close your eyes if you'd like, but it's not necessary. And just tell me if it feels the same to you, okay? So let's start with forehead, one side here, and then here. Did that feel the same on both sides? Okay, good. Yep. Now your cheek, one side here, one side here. Same, good. Now your chin, side here. Did that feel the same? Awesome, perfect. Okay. Next, I'm going to have you just clench your jaw shut, and I'm going to feel the muscles contracting in your face. Okay, just feeling. Good. Yep, your muscles were contracting. Perfectly normal. So that is really good. And the next thing I want to do is I'm going to have you open your mouth and kind of hold your jaw open. Don't let me close it, but I'm going to try to close it. But that is a very strong muscle, so I shouldn't be able to close it, and I wasn't able to, which is exactly how it should be. So that is really good. The next thing I want you to do is open your mouth and move your jaw from side to side. Okay. Yeah, perfect. Perfect. Very good. Now for cranial nerve 7, this is going to be, for cranial nerve 7, I'm going to start by having you scrunch your eyes closed. Just hold them closed, and again, this is a type of test where I try to open your eyes, go against what you're doing, force something, but I am not able to open them, so that's good. Yeah, so that's good. That's completely normal. And the next thing I'm going to be doing is I want you to smile for me, please. So just smile. And then I'm going to be looking at the symmetry of your smile. And everything looks very symmetrical. You have a very nice smile. I'm not just saying that. You do. You really do. So the next thing I want you to do now is to puff your cheeks out. And just hold it like that. I know it feels a little weird, but good. Relax now. So the next thing is cranial nerve 8. I'm going to look at cranial nerve 8, which is hearing. So for hearing, I'm just going to whisper some numbers into your ear, and I want you to verbally repeat them out loud to me just to make sure that your hearing is good. So let's start with 41. Good. Good. 74. 13. Good. Perfect. Yep. So typically I would use a tuning fork if I was having further concerns about your hearing, but that was completely fine. So I don't think using a tuning fork is necessary. So I think I'm going to skip over that, but typically that would be the next test. But it's not necessary in your case. So we're just going to move right along to cranial nerves 9, 10, and 12. So for cranial nerves 9, 10, and 12, I'm going to start by asking you to cough. Thank you. Good. So now that you've done that, the next thing I'm going to do is just look at your articulation of words, and I'm going to ask you to repeat the days of the week to me, and I'm just going to be watching for the way that you pronounce and articulate. Good. Yeah, that looked good. No problems. So the next thing I'm going to be doing is I'm just going to examine the back of your throat. So if you don't mind, I'm just going to use this tongue depressor. I just want you to say, ah, I'm just looking at the back of the throat. Just say ah one more time. Okay, yeah, no, that's good. Yeah, I just wanted to make sure that your soft palate was moving upwards with no problems, and it was. So the next thing I'm going to need you to do is just to stick your tongue out and move your tongue from side to side. So, good. I know some of these things can make you feel a little silly, but it's all for your health. So, the next thing I'm going to need you to do is just, you can put your tongue back in your mouth, and I'm going to put my hand on each side of your face, and I want you to press your tongue up against each side. Okay? Okay, so just do the side that my hand is touching, the other side now. Okay, perfect. So now the last cranial nerve that we're going to be looking at is cranial nerve 11. And for cranial nerve 11, I'm going to start by placing my hands on your shoulders, and I'm just going to have you try to push upwards against them. So just shrug your shoulders for me, please. Good. Very good. And the next thing I'm going to have you do is I'm going to place my hand against the side of your face, and I'm going to ask you to turn in towards it. So press up against it. Good. And now the other side, press up against my hand. Good. And I'm just going to have you do it one more time. Okay. Good. No, that was good. You passed. Yeah, which is a good thing. I know it can be stressful when you are dealing with a medical problem and doctors aren't able to pinpoint what is going on. Sometimes it's nice to just, get that diagnosis so that you can finally feel like, it'll be treated, you'll get better, and it'll go away. So I completely understand that. But in this case, I have, I do these cranial nerve exams a lot, and there have been quite a few times that if someone was having problems with vision, stress could be causing it, which I know is such an annoying thing because it's so easy to tell someone, well, it's stress, so the cure for that is don't get stressed. And of course, how are you supposed to, things in life can be stressful. It's stressful to know that stress is causing something in your body, and now you're stressed about trying to not stress, so it's a vicious cycle. So what I'm going to say for you is that I think stress could be behind this. I did read through your chart how you were describing the vision problems, and they don't really sound like anything that aligns with any serious condition or problem. I do think, well, it's not unfortunate because, I don't think there's anything serious wrong with you, which is great. So now the focus will be how we can help you cope with stress, how we can help you relieve some of the stress in your life. I would say let's start by addressing the fact that stress might be causing it, because sometimes people just knowing that it is something like that might actually make the symptom go away. So if you know it's stress, your body might be like, okay, there's nothing serious going on, let's just relax. So that's my advice. I can also give you some pamphlets on different coping mechanisms for stress. I could set you up with a therapist if you think that maybe you would like to talk to someone more. We have a great therapist in this hospital, so I know that she is accepting new patients at this time if that's something that you think you would be interested in. Okay? Okay, so I'm gonna go get all those papers and I will be back in here in a minute, but it's positive. It's good that, we think that this is something that we will treat. We'll find a way for you to cope with the things in your life that may be causing you to physically show symptoms of stress. This isn't super uncommon. It may not be the most common thing, but it does happen, and I do believe this is what is causing the visual changes. If you don't have any other questions for me, I'm going to go get those pamphlets, and I will get you the information for that therapist if you're interested in that as well. Okay, great. I'll be right back.